With cystitis, cyst means bladder and itis means inflammation. Therefore, cystitis describes an inflamed bladder, which is usually a result of bacterial infection, but also can result from a fungal infection, chemical irritants, foreign bodies like kidney stones, as well as trauma.
Now, a urinary tract infection or a UTI is any infection of the urinary tract which includes the upper portion of the tract, the kidneys,
And the ureters, and the lower portion of the tract, the bladder, and the urethra. So cystitis, when caused by an infection, is a type of a lower UTI.
Lower UTIs are almost always caused by an ascending infection, where bacteria typically move from the rectal area to the urethra and then migrate from the urethra into the bladder.
Having said that, on a rare occasion, descending infection can happen as well, where bacteria starts from the blood or a lymph and then goes to the kidney and make its own way down to the bladder and the urethra.
Normally, urine is sterile, meaning bacteria doesn't live there. The composition of urine reaches a high urea concentration and a low pH helps keep bacteria from setting up camp.
Also though, the unidirectional flow and the active urinating also helps to keep bacteria from invading the urethra and the bladder. Some bacteria though are better at surviving in and resisting these conditions and can stick to and colonize the bladder mucosa.
E. coli contribute the vast majority of UTIs. Also, other gram-negative bacteria can infect the bladder, including Klebsiella, Proteus, Enterobacter, and Citrobacter species.
On the other hand, gram-positive bacteria can also cause problems like Enterococcus species, Staphylococcus saprophyticus, which is actually the second common cause of UTIs overall after E. coli, and it particularly affects young sexually active women.
That said, as far as risk factors go, sexual intercourse is a major risk factor because bacteria can be introduced into the urethra. This is sometimes even referred to as the honeymoon cystitis. In general, women are at higher risk for cystitis than men due to having shorter urethra. This is because the bacteria, which are ascending up to the urethra, don't have to travel that far. Also, in postmenopausal women, there is a decrease in estrogen levels, which causes the normal protective vaginal flora to be lost, increasing the risk of UTI. Other risk factors include the presence of Foley catheter in the urethra, which can introduce pathogens. Another risk factor is having diabetes mellitus, since people with diabetes have hyperglycemia or high blood glucose. Normally, with an infection, neutrophils move out of the circulatory system towards the infection, called diapedesis, as well as to carry out phagocytosis. But hyperglycemia inhibits these processes. Also, infant boys with foreskin around their penis have a slightly higher risk of UTI compared to infant boys who've had a circumcision. A final important risk factor is impaired bladder emptying, causing urinary stasis. This means that the urine tends to sit still, giving the bacteria the chance to adhere and colonize the bladder. Symptoms of cystitis include suprapubic pain, which is pain in the lower abdomen, dysuria or pain or difficulty in urinating, as well as frequent urination and urgency, meaning you have to go a lot or you have to go now. Symptoms differ by age. Infants may have fever, become fuzzy, or feed poorly, whereas elderly patients may feel fatigue, become incontinent, or may even develop dementia. Symptoms that are not typically present in lower UTIs are systemic signs, like fever, nausea, or vomiting. Also, pain at costovertebral angle, which is the angle formed on either side of the back by the 12th rib and the vertebral column.
If urinalysis is done, there might be signs of inflammation like pyuria, which is the presence of WBC in urine which can make the urine appear cloudy. Having a couple of WBC in urine is normal, but it is considered abnormally high if it is above 5 per high power field or more than 10 WBC per ml on a hemocytometer. Similarly, a dipstick test might show the presence of leukocyte esterase, which is an enzyme created by leukocytes or WBC. It might also be possible for nitrites, since gram-negative microorganisms like E. coli convert nitrates in the urine to nitrites. But it is worth remembering that not all uropathogens are able to do that. Urine culture is a gold standard for diagnosis. It is considered positive if it shows more than 100,000 colony-forming units per ml from a clean catch urine sample. Although a number of colony-forming units per ml might still indicate an infection depending on the source of specimen and specific clinical scenario. And remember that this test assumes that bacteria that grows is a known bacteria that cause UTI and that the patient has clinical symptoms. If there is pyuria but urine culture does not reveal bacteria, this is known as sterile pyuria, which suggests urethritis or inflammation of urethra, as opposed to cystitis. Isolated urethritis is most commonly caused by Neisseria gonorrhea and Chlamydia trachomatis, both of which are sexually transmitted infections. For UTI imaging studies, it can be helpful, for example, renal ultrasound that can be used in children who could have kidney malformation, which could contribute to developing UTI. In addition, voiding cystourethrogram or VCUG may be used, in which the individual is given radiocontrast fluid and fluoroscopy, which are like real-time x-rays, and they watch the fluid gets urinated out and is particularly helpful in children with severe or recurrent UTIs to detect evidence of vesico-urethral reflux, which is retrograde movement of urine from the bladder back up to the ureters and kidneys. The degree of it can vary, and it is an important risk factor for kidney scarring with a UTI. Finally, in some situations, renal scintigraphy using DMSA can be used to detect evidence of kidney scarring. Treatment for lower UTI is usually antibiotics targeted at the bacterial cause, and symptoms usually clear up within a few days as urine becomes sterile. Pain medications may also be given. Preventing UTI mainly involves drinking plenty of fluids to help flush out bacteria and emptying the bladder as often as possible, which is relevant for women, especially after sexual activity. And maintaining good hygiene like wiping from urethra to the rectum. As a quick recap, cystitis is inflammation of the bladder which is caused by bacterial infection, which makes it a type of lower UTI. E. coli is the most common culprit, and risk factors include female gender, sexual intercourse, having catheters, diabetes mellitus, having penile foreskin, and urinary stasis.